Hi all, good afternoon. I'm Dr. Wannabe Strong, and here today we are working on question 2 for the Family Medicine Board's review. QID is 37509. Your patient is an 81-year-old male with a history of hypertension, type 2 diabetes mellitus, hyperlipidemia, and congestive heart failure. He takes metformin, lisinopril, and pravastatine. He lives in a nursing home. He presents by ambulance to the emergency department for evaluation of new onset confusion. He appears acutely ill and confused about the date and place. His blood pressure is 90/60. His heart rate is 92 beats per minute, and his respiratory rate is 22 per minute. His temperature is 35 degrees centigrade. Oxygen saturation is 92%. He has crackles in his lung bases. A scutellation of the heart reveals a regular rhythm without murmur, rub, or gallop. Lower abdomen is tender without rebound or guarding. He wears an adult diaper for incontinence, and his intertriginous pelvic folds are red and excoriated with a rash pictured below. He has no cyanosis, clubbing, or edema. Hemoglobin is 8. Hematocrit is 24%. White blood cell count is 18,000. Platelets are 55,000. Serum lactate is 42. Blood glucose is 160. BUN and creatinine are 30/2.0. Which of the following is appropriate for this patient? A. Mechanical ventilation, CVP monitoring, vancomycin and impenem pending cultures, renal dose dopamine, and intensive insulin therapy targeted to normal glycemia. Option B, mechanical ventilation, vancomycin, and impenem pending cultures. Add empiric treatment for systemic candidiasis. Begin dopamine and insulin infusion. Option C, empiric antibiotics with coverage for systemic candidiasis, platelet and packed red blood cell transfusion. Option D, renal dose dopamine, transfuse PRBCs, platelets, empiric antibiotics with coverage for candidiasis, intensive insulin therapy. And last but not least, option E, cultures, empiric antibiotics including coverage for disseminated candidiasis, supplemental oxygen, maintain blood pressure, consider dobutamine. Text us your answer.